Let's look at growth and development. We'll start with infancy, from birth to 12 months. So these are the stages of growth and development in an infant. You can see from the first to third month, the infant is able to lie on his back. The head sags at this point, and you can see early crawling movements. By 2 months, you want to note that on the Nclex, there's closure of the posterior fontanelle. There's closure of the posterior fontanelle. The infant is able to turn from side to back, and his eyes is able to follow a moving object. The first social smile appears for the first time during the second month. At about the third month, the infant can bring objects to his mouth at will. He's able to hold his head erect and steady. He usually smiles in his mother's presence or laughs audibly. By 4 months, you will notice there is evidence in pleasure or evidence of pleasure in social contact. Maybe someone carries him, he's happy. Once he's making social contact, there's evidence of pleasure, or the child is happy, the infant is happy. The moral reflex is absent after 3 to 4 months. So the moral reflex disappears after 3 to 4 months. So at this stage, at about 4 months, the moral reflex is gone. About the 5th month, his birth weight should have doubled. So about the 5th month, his birth weight should have doubled, and he is able to take objects that are presented to him. At about the 6th month, teething may begin, maybe with the lower central incisors coming up first. The infant can turn from back to stomach, and he has this early ability to distinguish and recognize strangers. So that happens at about the 6th month. At about the 7th month, he's able to sit for short periods using his hands for support. He's able to grasp toy with hands. Between these 6 to 8 months, this fear or anxiety with strangers begin to appear. At about the 9th month, he can respond to parental anger. Expressions like dada may be heard. He's able to crawl well at about the 10th month. He can push himself to standing position with support at about the 10th month. He can also vocalize 1 or 2 words. At about the 11th month, you would see the infant is able to stand erect with support. And about the 12th month, the birth weight should have tripled. He will need help walking. He can actually sit from a standing position without assistance. He's able to eat with his fingers and can usually say 2 words in addition to mama and dada. A key priority at this stage is to be sure to select age-appropriate toys. So we can see newborns to 3 months. The sensory skills are developing at this stage. We want to give them rattles, sensory toys, handheld toys, musical toys. At 3 months to 6 months, their gripping and grasping skills are beginning to develop properly. So you want to give them rubber toys, board books, soft toys, teething rings. Again, we want to make sure that we give them age-appropriate toys. By 6 to 9 months, they are beginning to become more dexterous. Fine motor skills are developing. So age-appropriate toys at this period would be balls, books, soft blocks with round corners, moving toys, stuffed animals. So we want to give brightly colored toys that are small enough to grasp and large enough for safety. About 9 months to 1 year, the infant is moving around the house, exploring, learning, and possibly tasting everything. So we want to give push and pull toys, shape stories and puzzles, and also books, because at this stage they are developing their problem-solving skills and they are very mobile and their language skills is also developing. As part of our plan and implementation at this stage would be to introduce complementary foods. So you want to introduce one food at a time for each 2-week period. So we want to start with the least foods that they could be allergic to or that could cause an allergy. So we want to give the least allergenic foods in the first half of the first year. So what kind of foods are least allergenic, like your iron-fortified rice cereals? So that's an example of a least allergenic food. So we can progress from least allergenic food to more allergenic foods like orange juice and egg. So those are more allergenic. And these ones will be offered in the last half of the first year. So your usual order is to start with the least allergenic food like your cereals, and then you can progress to more allergenic foods like fruits, vegetables, potatoes, meat, egg, orange juice. Again, you want to be conscious of the phases of separation, what their reaction to separation might be. So there's usually the protest stage where the infant will cry, scream for the parents, they are inconsolable by others. And after this stage, they will move to the despair stage where the crying ends. The child becomes less active, is disinterested in food or play. If he has any security object, you will see him clutching it and holding on to that particular object. And then they can progress to the denial stage where they appear to be adjusted. It now begins to show evidences that portray that he's interested in the environment. Even when the parents come around, he ignores the parents when they return. He feels or he looks resigned and not contented. So that will be the denial stage. We need to be conscious of these phases of separation anxiety. At 15 months, we're looking at the toddler now. At 15 months, developmental milestone we expect to see would be the child can walk alone. He can build 2 block towers. He's able to throw objects. If you give him an object, he's able to grasp it, for example, giving him a spoon. And he's also able to name commonplace objects. At 15 months, the anterior fontanelle is usually closed. Remember, we said the posterior fontanelle closes at 2 months. So by the 18th month, the anterior fontanelle should have closed. The baby or the child is able to walk backwards, is able to climb stairs, he can scribble with a pen or a pencil. He's also able to build 3 block towers. By this stage, his vocabulary is at about 10 words, and you begin to see thumb sucking in this child. At 24 months, there's early efforts at jumping. The infant can now, or the child can now build between 5 to 6 block towers. There's a marked improvement in his vocabulary. It goes from 10 to 300 words within the period of 24 months. And again, the child is able to obey easy commands. At 30 months, the child is able to walk on tiptoe. He can build 7 to 8 block towers. He's able to stand on 1 foot. And he has sphincter control for toilet training. As part of your plan and implementation, remember this period is where the toddler begins to establish independence. Potential problems you will see in toddlerhood include negativism, which is characterized by refusal to obey requests, and the child has tendency to resist directions to older adults like his parents. For instance, a parent might request his child to come out of the playground, and instead the child will demonstrate active negativism by running away. Another potential problem is safety concerns and also abuse. So part of your plan would be you always want to screen for growth and development in the toddler. You want to reinforce the desirability of stable daily routines for play, feeding, and rest. And again, you want to select age-appropriate toys for the toddler. For the preschool, which is between 36 months to 6 years, at this point, this would be between 3 years of age, 4 years of age, 5 years of age, 6 years of age. So want to look at the developmental stages for a 3-year-old. At this point, they should be able to copy circles. They should be able to build bridges with at least 3 cubes. There's less negativism than we see in the toddler. There's decreased tantrums. They're able to learn from experience. They can ride tricycles. They can undress without help, and their vocabulary goes up to about 900 words. They're able to use sentences. And again, it is normal for them at this stage to invent an imaginary friend. At 4 years, they're able to lace their shoe, brush their teeth. Their vocabulary increases to at about 1,500 words. At 5 years, they're able to jump ropes, dress without help. They have a vocabulary of about 2,100 words. This stage, they can tolerate increased separation from their parents. There's beginning of cooperative play. So you see that at about 5 years old, they are able to cooperate and play with other children or other preschoolers. And they're also able to skip on alternate feet and tie their shoes. So age-appropriate toys for this stage would be housekeeping toys, coloring books, tricycles, and again, because of safety concerns, they must wear a helmet. If we look at the school-age children, which will be between 6 to 12 years of age, at this period, there's intense, there's an intense period of industry and productivity. Logical patterns of thought begin to develop. At this stage, pair relationship is very, very important, and they're able to establish what they like and what they don't like. So your potential nursing diagnosis at this stage will be focused on difficulty with social relationships, difficulty with body image, self-esteem, self-concept. And again, another concern we should be worried about at this stage would be bedwetting or enuresis. We could also have encopresis. This would be incontinence of feces. And again, safety concerns, there could be injuries, even head lice at this stage is very, very common. So if you look at the individual stages at 6 years, you'll notice that they are self-centered, they show off, they are very rude, they are very sensitive to criticisms. There's appearance of the first permanent teeth. At 7 years, there's increased self-reliance for basic activities. They're able to engage in team games, sports, organization. They develop concept of time at about this age, 7 years. And at this stage, boys would prefer playing with boys and girls would prefer playing with girls. At about 8 years, friends are sought out actively, and eye development is generally complete at this age. They move more gracefully, and writing replaces printing. At 9 years, Skillful manual work is possible at this age. Usually experience conflicts between adult authorities and peer groups. Generally, they are better well behaved. And there's that conflict between needs for independence and dependence. At about 10 to 12 years, the remainder of the teeth erupt, except the wisdom tooth. They're able to use telephone. They are capable of helping with chores and all of that. There's increasing responsibility. They are more selective at this stage when choosing friends. And then this interest in the opposite sex begins to develop. They start having love, they start conversing more often, and they're able to raise pets. So let's look at adolescence, which is the period of 12 to 20 years. So at this stage of growth and development, body image is very important. Peer and social relationships are also very important. Identity is also very important. Autonomy is very, very important for the children that fall under this category or for the adolescents. So what are our potential nursing diagnoses for this client group? Injury. There's a risk for injury. Self-esteem disturbance is possible, or there's potential issue with self-esteem disturbance. And again, health maintenance is altered due to puberty and all of that. What are the potential problems you could see in an adolescent? Adolescent pregnancy is one. There could be poor self-image. Safety is also an issue. There could be drugs and alcohol misuse or abuse. AIDS as a result of sexual experiments. You would also look out for high school dropouts and again, violence. Talking about the physical development that occurs with puberty. So this is a period of attainment of sexual maturity. You will witness rapid alteration in height and weight. The girls will develop more rapidly than boys. And puberty, the onset of puberty is related to hypothalamic activity, which influences the pituitary gland to secrete hormones that go about to affect the testes to produce androgens and also affect the ovaries to produce estrogens. And these hormones determine development of secondary sexual characteristics. You will see pimples or acne as a result of increased sebaceous gland activities in these adolescents. There's also increased sweat production. There's clumsiness, these initial problems with coordination. So they tend to appear clumsy. And this is related to rapid, unsynchronized growth of many systems. So you need to be conscious of that. It might appear to be clumsy and it's expected. Again, there could be rapid growth, and this could cause easy fatigue in the adolescents. And at this stage, they are preoccupied with their physical appearance. What changes do we see in the male? There's increase in genital size. The penis get longer and wider, and the testes get larger. There could be breast swelling. There's appearance of pubic, facial, axillary, and chest hairs. The voice begins to deepen, and there's production of functional sperms. And you could also have these nocturnal or nighttime emissions. So this could be expected. In terms of female changes, there's an increase in pelvic diameter. The whole body begins to get more curvy. There's obvious breast development, altered nature of vaginal secretions. And again, there's appearance of axillary and pubic hair. And at this point, menarche would start, which would be the first menstrual period. So there's more complete development of secondary sexual characteristics in the adolescent period. There's improved motor coordination. The wisdom teeth appears at about ages 17 to 21. In terms of psychosexual development, it could be seen in these adolescents where they use masturbation as an expression of sexual tension. They start to develop these sexual fantasies, and they could even go about experimenting with sexual intercourse. With psychosocial development, they're preoccupied with rapid body changes. They're confused with what is normal. They tend to conform to peer pressure. At times they are moody. There's increased daydreaming, increased independence. And at this point, they are moving toward a mature sexual identity. Part of our plan and implementation would be to screen the adolescent routinely for growth and development. You want to reinforce the desirability of stable daily routines for work and rest. You also want to continue to reinforce the idea of parents as role models who allow their children to make age-appropriate decisions. More importantly, you want to counsel adolescents to delay impulsive actions with long-term consequences. For example, adolescent pregnancies, drug and alcohol abuse, HIV/AIDS, high school dropouts, and you want to also encourage the use of problem-solving skills. You also want to promote appropriate, safe approaches to resolve conflicts with peers and adults. 20 to 40 years of age is another group. Here, work and career is of utmost importance. And at this period, intimacy begins to be established. So part of our potential nursing diagnosis for this stage would include altered health maintenance, altered self-esteem, difficulty with relationships. And again, there's also potential for the increased stress. So you see there's an overlap of this period at 20 to 33 years. There's increased reality perception. There's that independence from parents, possible marriage. At this stage, they begin to realize that everything is not cast in black or white. There are some gray areas. They begin to look towards the future, hope for success. They develop a maximum problem-solving ability at this stage. At about 33 to 40 years, they begin to take life more serious. They want to achieve or accomplish major goals. And there's this sense of satisfaction. At about 35 to 40 years, they begin to question themselves. There's that fear of middle age and aging. They tend to reappraise the past, discard unrealistic goals, and they are what we refer to as the sandwich generation, because at this point, they are more concerned with their children, or they are sandwiched between their children and their aging parents. At this stage, there's increased awareness of mortality and a potential loss of significant others. As part of your plan, for these clients, you want to evaluate relationships, especially with their chosen partner. At about 40 to 65 years, you want to assess cognitive functioning, you want to assess relationship changes, you want to assess work and career. So at 40 to 55 years, we'll see the hair beginning to turn gray, the skin begins to wrinkles, pain and muscle aches is common. At this stage, they realize that what is left in front is way shorter than the lifespan they've already spent. Menopause could set in at this stage. There's decreased sensory acuity. At this point, they may have become powerful policy makers or leaders. At 48 to 60 years, these clients begin to evaluate the past, set new goals, define value of life and self. They start assessing their legacies, be it professional or personal. There's a balance between old and young age, and they begin to accept changes of aging. And at 50 to 65 years, there's increasing physical decline, increasing forgetfulness. They begin to accept these limitations. They tend to modify their lifestyle to suit these changes. Again, there's less restricted time because they're able to choose different activities. As part of your plan, You want to help the client to adjust to changes of aging. You want to help them adjust to changing roles. And you want to also carry out anticipatory guidance. With those at 65 years and above, again, we would still need to assess physical and cognitive functioning, significant relationship changes. Again, we must note that activities may be limited. In this age, there may be decreased sense of taste and smell, and there could also be financial constraints. In this group of clients, self-care deficit is a potential problem. They could be isolated, or they could feel isolated. They could have altered relationships. There could be decreased independence, and family processes could be altered. So at this stage, at 65 to 80 years, there's physical decline, loss of significant others, appraisal of life. They appraise what their achievements have been. We could start seeing chronic diseases becoming an issue at this age. And again, there could be changing social roles. For clients greater than 80 years, signs of aging become very obvious. Few significant relationships, they feel withdrawn. There's that risk of isolation. Self-concern is also a major issue. At this stage, they begin to accept debt and begin to face mortality. And again, there's decreased abilities. In terms of your plan, you want to assist the clients with adjusting to lifestyle changes. Always allow the client to verbalize their concerns. You want to try and assist and prevent isolation, and also provide assistance as required.